All right. So, without further ado, this is our presentation, Understanding Youth Substance Use, Prevention Through Education and Community. As you all know, this is Alex, I'm Scarlett with the Memphis Area Prevention Coalition. Welcome everyone, and thank you for joining us after that little debacle. We're here to talk about a topic that impacts every corner of our community, youth substance use. Today's presentation will cover the current landscape of youth substance use, why it matters, how it affects the developing brain, specific substances being misused, and how prevention efforts through education and community can make a powerful difference. And before we begin, Jack kind of went over it, but just a little bit about MAPC itself. We are a grassroots organization dedicated to addressing substance misuse through collaboration and community. We are made up of partners from 12 different sectors: education, law enforcement, parents, healthcare, and others. Our mission is to reduce youth substance use in Shelby County by working together to promote a healthier community. We believe prevention works best when it's rooted in strong relationships and shared responsibility.
Okay, before we dive in, I'm going to say just a couple of jokes, and it's mainly so I can feel better. How did the PowerPoint cross the road? It slides to the other side. What do you call a fake noodle? An impasta. All right, what we'll be covering today. First, we'll start with a myth or fact warm-up to get us thinking. Then we'll move into what youth are using, explore consequences both short and long-term, examine how the brain develops, and take a deeper dive into specific substances. We'll also look at warning signs and root causes of use, and wrap up the programs MAPC supports and local resources available.
All right, so let's start with a quick warm-up, myth or fact. So I'm going to read a statement. You're going to think to yourself whether it's a myth or a fact, and then all of y'all are going to be very responsive and tell us verbally, not just in your minds, whether it is a myth or a fact. Are y'all ready? Louder, please. There we go. Woo!
Underage drinking contributes to more than 4,300 deaths among young people each year.
Myth.
Fact.
All right, next one. ENDS, vaping devices, are a safe alternative to cigarettes. Yeah. Correct. Good job, everybody. According to the Truth Initiative, no current vaping device has been proven to be a safe alternative to traditional cigarettes.
Myth or fact, current cannabis products are a similar potency as they were 25 years ago. Myth. According to the NIDA and the DEA, cannabis products contain more than 3 times as much THC as 25 years ago.
All right, and I believe this is the last one. More than 80% of youth ages 10 to 18 say their parents are the leading influence on their decision whether to drink. Myth or fact? And y'all are correct. That is a fact.
Teachers and other school personnel often see or hear a lot about substance use through their interactions with youth. Today we are going to talk about trends regarding youth substance use and talk about the importance of substance use prevention. As the Substance Use Prevention Coalition in this area, we at the Memphis Area Prevention Coalition are committed to addressing the root causes of youth substance use before they escalate into lifelong challenges. Our work focuses on education, community, collaboration, and in creating environments where young people are supported, informed, and empowered to make healthy choices. We partner with schools, parents, healthcare professionals, law enforcement, and other community sectors to implement evidence-based prevention strategies. Presentations like this one are a key part of our mission.
All right. According to the most recent Tennessee Together survey, the substance most reported by students is vaping. The substances they say are easiest to get: tobacco products and alcohol. And here's the critical stat. 1 in 15 students have misused prescription medications. That's huge. It highlights how access and perception play major roles in what gets used.
Youth overdoses. While youth make up a smaller percentage of overdose deaths overall, the number is growing. Nearly half of youth overdose deaths involve fentanyl, and most are due to multiple substances being taken at once. This includes not just illicit drugs, but also prescription and over-the-counter medications. It's a reminder that access to these substances, intentional or not, can be deadly. Examples of substances involve prescriptions like antipsychotics and antidepressants, over-the-counter medications such as Benadryl and Tylenol.
Prevention is crucial because the earlier someone starts using substances, the more likely they are to experience long-term negative effects. Nearly 90% of people with addiction started using before the age of 18. Substance use increases the risk of suicide, mental health struggles, traffic fatalities, and health conditions like heart and lung disease. These aren't just future problems, they affect young people now. So, why is youth substance prevention important? Youth substance use increases the vulnerability, and I'm going to pause right there and just kind of go over why we use the word vulnerability. We use it because it acknowledges that often a combination of factors, not just a single one, increase the likelihood of a condition. So for substance use, we recognize that substance use alone is not likely to cause these conditions. It is substance use in combination with other factors, like behaviors that occur with substance use or access to services, that can mitigate some of the other contributing factors. Let's take a moment to talk about the real and very serious health effects that can result from youth substance use. These risks go far beyond getting in trouble or making a mistake. It can truly change a young person's life trajectory, both in the short term and long term. In the short term, substance use increases a young person's risk of experiencing violence, including dating violence. Substances can impair judgment, lower inhibitions, and lead to risky or unsafe situations. Some young people may also be using substances to cope with violence they've already experienced. It also raises the likelihood of developing or worsening mental health conditions like anxiety and depression. And there's also a direct link to suicidal thought and behaviors. In fact, youth who report substance use are significantly more likely to attempt suicide than their peers. Additionally, if the substance is being injected, there's a risk of contracting serious infections like HIV or hepatitis, especially when needles are shared or not sterile. Now let's talk about the lifetime effects if substance use continues. Youth are more likely to face chronic health conditions such as heart disease, lung disease, and strokes, all of which are normally associated with older adults, but start developing from unhealthy habits in youth. Cancer is also a major risk, especially with substances like tobacco, alcohol, and certain synthetic drugs. Long-term substance use continues to damage the brain and the body. It can lead to ongoing mental health conditions that affect relationships, employment, and overall quality of life. And again, just like in the short term, those who inject drugs over a long period are at a higher risk of contracting or spreading blood-borne diseases like HIV and hepatitis. The key takeaway here is that these consequences aren't just what might happen someday. Many are already affecting young people now. Prevention is about giving youth the tools and support to avoid these harmful paths before they begin.
Now let's talk about a little bit of brain development. When thinking about brain development, think about what kids at different ages can do. Babies are pretty limited in what they can do. Their activities are focused on staying alive, breathing, and eating. The most used part of the brain are the brainstem and the midbrain. We see more development of the limbic system as kids get older. Skills like motor regular, so moving the body, and managing emotional responses come from the limbic part of the brain. This is when more of our brain is involved in relational activities with other people. The brain isn't fully developed until the age of 25. It grows from the most basic functions to the most complex, meaning the parts responsible for planning and judgment come last. Trauma and chronic stress, known as ACEs, which is adverse childhood experiences, can disrupt this development. When young people use substances, it impacts those growing areas and can cause long-term developmental delays. Let's look at the three major parts of the brain. The basal ganglia deals with motivation and reward. Substances activate it and over time make it harder to feel pleasure without them. The extended amygdala controls stress and anxiety. Repeated use makes it harder to manage emotions. The prefrontal cortex is where decision-making happens, but it's the last to develop. So this makes youth more prone to risky behavior, especially when substances are involved.
All right, so just to get more into specific substance uses, the data we have gathered is from the Tennessee Together survey, which is a statewide survey given every 2 years to 8th, 10th, and 12th graders. It asks about substance use, beliefs, and behaviors, and keep in mind that this is preliminary data, but it gives us critical insight into what's going on right now in our schools and communities.
So, prescription medication misuse. Examples of prescription medication misuse include taking someone else's medication, taking it to feel euphoria, taking a different dose than prescribed, and taking it differently than prescribed. Examples of that include crushing, snorting, and injecting. Prescription medications that frequently get misused are opioids, benzodiazepines, and stimulants. When referring to youth, 37% of students reported these medications easy to obtain, 6% reported misusing these substances, and 2.9% misused these prescriptions in the last 30 days. Now let's talk about how these medications work in the body and their effects. Opioids tell the brain to block pain and give feelings of euphoria. Short-term effects include feelings of calmness, confusion, slowed or stopped breathing, nausea, vomiting, and constipation. Long-term effects include high potential dependency, muscle pain, and heart and lung infection. Okay. Stimulants. Stimulants work in the body by speeding up messages between the brain and body, elevating mood and increasing feelings of well-being, energy, and alertness. Short-term effects of misuse include high blood pressure and decreases in blood flow and blood sugar. Long-term effects include the high potential for dependency, depression, and high blood pressure. As a person in recovery, I can attest that casual misuse of stimulants led me down a dark road of drug abuse and alcoholism. However, it is important to note that when a person with ADHD is taking the medication as prescribed, prescription stimulants are safe, effective, and do not increase the risk of developing substance use disorder. Illicit fentanyl. Like briefly mentioned in the presentation before us, illicit fentanyl is incredibly dangerous. It is being mixed into other substances, sometimes even fake prescription pills. Just 2 milligrams can be lethal. In Tennessee, fentanyl is involved in 3 out of 4 overdose deaths. Importantly, there is no lab-confirmed cases of fentanyl in marijuana yet, but that could change. This is why fentanyl test strips and naloxone are so important. Also, as mentioned by the OCU, fentanyl is classified as an opioid and a depressant. It works in the body by attaching the receptors in the brain, causing the body to relax and feel euphoria. In the short term, it causes feelings of calm, sleepiness, and confusion. It can slow or stop breathing, cause nausea, vomiting, constipation, and lead to an overdose. Long-term effects can lead to a high potential for dependency, cause cancer, damage the liver, cause strokes, and lead to high blood pressure. Later in the day, Lincoln will be covering alcohol in much more detail, but we do want to provide you with a few statistics regarding youth and alcohol. As most of you probably know, alcohol is a depressant. When youth binge drink, which is defined as 5 or more drinks on an occasion, it drastically impairs judgment and coordination. It also increases risk of injuries, accidents, and long-term problems like liver disease and high blood pressure. The earlier someone starts drinking, the greater their risk for dependency later in life. According to surveys, 30% of Tennessee students reported ever using alcohol. 60% said it was very easy to obtain, and 11.9% reported using alcohol in the last 30 days.
All right, and now a little bit about tobacco and nicotine. Nicotine is classified as a stimulant, meaning it speeds up the body's systems, particularly the central nervous system. Common examples include cigarettes, cigars, chewing tobacco, and snuff. These products all contain nicotine, which is the addictive substance that keeps users coming back. So, how does nicotine work in the body? When it's inhaled or absorbed, nicotine quickly enters the bloodstream and triggers the release of adrenaline. This creates a short burst of energy and alertness, often what users describe as a buzz. In the short term, nicotine causes your blood pressure, breathing rate, and heart rate to go up. It can also suppress appetite and give a temporary mood boost because of the adrenaline spike, just like this presentation is doing now for me. But the long-term effects are where we see real danger. Nicotine and tobacco use can lead to a high risk of addiction, and chronic use is linked to various cancers, including lung, mouth, stomach, kidney, and bladder cancer. It can also cause lung issues, heart disease, eye problems, and something a lot of young people notice early, yellowing of the teeth. On the right side of the slide, you'll see some quick stats from Tennessee youth. About 12% have reported ever using cigarettes, nearly half say it's easy to get tobacco products, and 3.5% report smoking in the past 30 days. This shows us that even though cigarette use has gone down over the years, access and experimentation are still concerns, especially for teens. So now to the real problem, vaping. Vaping devices or electronic nicotine delivery systems include things like vape pens, e-cigarettes, and other battery-operated devices. These devices work by heating a liquid, often called e-juice or vape juice, which creates an aerosol, it sounds nasty, that's inhaled into the lungs. Most of these liquids contain nicotine, the same addictive chemical found in traditional tobacco products. Despite what advertising may suggest, these devices are not harmless. In fact, they contain a mix of harmful chemicals, including metals and substances linked to lung cancer. So what makes vaping appealing to youth? A lot of it has to do with targeted marketing, flavors like candy and fruit-flavored vape juice, sleek device designs, and the misconception that it's safer than smoking. Many teens don't even realize they're consuming nicotine when they vape because the flavors mask the harshness. This has serious consequences. Early exposure to nicotine can prime the adolescent brain for future addiction, not just to nicotine, but potentially to other substances as well. And just a little bit of stats, almost 30% of students surveyed reported that they had ever used a vape with nicotine. That's nearly 1/3 of Tennessee students, which is an incredibly high number. Of those, over 13% said they had used a vape within the past 30 days, which points to regular ongoing use. Even more concerning, more than 60% of students said it was very easy or fairly easy to get access to these products. This shows us that regulation and enforcement need to be strengthened and that prevention and education must also address this accessibility issue. So what's the takeaway? Vaping is not just a passing trend. It's a widespread public health issue among teens driven by misinformation, easy access, and addictive design. And a little deeper dive into tobacco and vaping. Many people think vaping is completely different from traditional smoking, but in reality, the core problem is the same, nicotine. Both cigarettes and most vape products deliver this highly addictive substance, and both carry significant health risks. We're going to explore how each affects the body, what chemicals they contain, and why both are particularly dangerous for young people. Anywho, here we compare the known risks of tobacco with what we know and what we're still learning about vaping. Tobacco's health risks have been studied for decades: lung cancer, heart disease, strokes, COPD, and even a weakened immune system. And let's not forget the dangers of secondhand smoke. Vaping, while newer, is not exempt from risk. We've seen cases of vaping-associated lung injury and other cardiovascular issues. One of the scariest risks, popcorn lung, which is caused by chemical flavoring called diacetyl, which is present in some vape liquids. So while vaping might look or feel cleaner than smoking a cigarette, it's not safe. It's just a different way of delivering a harmful and addictive substance. So what's actually inside vape juice? It's quite disgusting. So first, obviously, nicotine, which is highly addictive and disrupts brain development in young people. It's the same chemical found in typical cigarettes and is often present in higher concentrations in vapes. Next, we have formaldehyde. Yes, the same chemical used to preserve dead animals in science class. It is known as a carcinogen and causes respiratory irritation. Next, we have acrolein, which is a weed killer. When inhaled, it can cause severe damage to the lungs. Next, we have diacetyl, which is a chemical used in artificial butter flavoring and has been linked to popcorn lung, a condition where the smallest airways in the lungs become scarred and inflamed. Sorry, I've been sick for the past week, so if I'm sniffling, just bear with me. Next, we have propylene glycol, which is commonly used in antifreeze. When it's heated, it can form harmful byproducts like formaldehyde. When we hear these names, it's easy to think those can't be possibly in products marketed to teens, but they are. This is why education is crucial. Vaping among teens, a growing concern. Vaping has become one of the most significant substance use concerns for teenagers today. Why? Because the adolescent brain is still developing. Nicotine exposure during this period can cause long-lasting changes, increasing the risk of addiction, mood disorders, and cognitive issues. It can also prime the brain to seek out other addictive substances. Oh my God, my nose. The numbers from 2024 are alarming. Over 30% of high school students have tried vaping. 1 in 4 seniors are using vaping products regularly. This isn't just an experiment for some kids, it's a habit. Why the high numbers? Misleading advertising plays a big role. Flavors like mango, blue raspberry, and bubblegum make these products seem harmless or even fun. But the truth is that these are commercial tactics designed to hook a new generation on nicotine. Secondhand smoke and vaping. We often talk about the personal risk of using tobacco or vapes, but let's not forget the impact on people nearby. Secondhand smoke from cigarettes contains more than 7,000 chemicals, hundreds of which are toxic and around 70 that are known to cause cancer. Even brief exposure can increase the risk of heart disease and lung cancer in non-smokers. Secondhand aerosol from vaping is not harmless either. It can contain nicotine, volatile organic compounds, heavy metals like nickel and lead. Additionally, children, pregnant women, and people with asthma or other respiratory issues are especially at risk. Just being near someone who's vaping could have negative health impacts. This is why many schools, workplaces, and public venues are starting to include vaping in their no smoking policies. So real quick, let's just zoom out and talk about the broader public health perspective. Tobacco regulation has a long history in the US and internationally. Measures like higher taxes on tobacco products, bans on public smoking, and graphic warning labels on packaging have helped lower smoking rates significantly over the past few decades. These changes didn't happen overnight. It took years of advocacy, research, and policy work. We're starting to see similar strategies with vaping. There are age restrictions, which typically require users to be 18 or 21, depending on the state. Regulations on flavored products, because flavors are a huge hook for youth, and restricted use in public areas like schools and parks. But the science is still catching up with the popularity of vaping. Because it's newer, there's less long-term data available. That's why early education and prevention efforts are even more crucial. On the tobacco side, efforts like public smoking bans and health campaigns continue to lower usage rates. Warning labels have become more aggressive to communicate real health dangers. For vaping, regulators are scrambling to catch up. Law now requires age verification and are increasingly restricting flavored products with devices. And some areas are moving to completely ban flavored vapes to reduce youth initiation. But regulations alone aren't enough. There has to be consistent enforcement and public awareness. That's where community involvement and education campaigns, like what we do at MAPC, come in. Let's talk about solutions. Quitting is hard. I know a lot of us in this crowd have tried to quit at some point in time. Some of us successfully, some of us not. But it's not impossible, and help is available. Tobacco cessation strategies include nicotine replacement therapies, which are patches, gum, and lozenges, the hard word, to reduce withdrawal symptoms. Prescription medications like Chantix and Zyban to help reduce cravings. Counseling and support groups to provide emotional and behavioral support. And apps like Quick Start or Smoke Free Teen use daily check-ins and motivational tools. Vaping cessation, especially for teens, often requires targeted programs. These might combine behavioral support with digital tools and social strategies. One of the most important steps in creating a safe, shame-free space where someone can admit they need help.
Okay, now let's talk about cannabinoids. This slide introduces cannabis and its compounds, which can be confusing due to the evolving legal landscape and terminology. Cannabis refers to the plant itself. Marijuana is a common name for the dried parts of the plant that are smoked or consumed. THC is a psychoactive compound that causes the high. CBD does not cause a high and is often marketed for pain relief or relaxation. Synthetic cannabinoids like spice or K2 are human-made chemicals that are often much more dangerous and unpredictable. Understanding the difference between these substances and how they interact with the brain is key to recognizing risk and making informed choices. Like also touched on before, marijuana is used in joints, blunts, vapes, pipes, and cooked in candy. It works in the body by affecting brain cells in the parts of the brain that control coordination, memory, pleasure, and judgment. Short-term effects include an altered sense of time, slowed reaction times, increased hunger and heart rate. Long-term effects include problems with learning skills, breathing, coughing, and lung sickness. As shown on this slide, 16.2% of students reported ever using marijuana, 44.7% said it was very easy to obtain, and 9.3% reported using marijuana in the last 30 days. Illicit stimulants. These drugs increase dopamine levels, which boost energy and create euphoria. However, they come with dangerous side effects. Increased heart rate and body temperature, loss of appetite, high risk for addiction, long-term impacts like paranoia, memory loss, and severe weight loss. Methamphetamine is especially concerning in Tennessee. It is the most seized drug in the state according to TBI data, although used amongst youth is relatively low. Just 1.2%, the availability and potency make it a significant risk.
Substance use in context. We often treat substance use as the cause of problems, but it can also be the effect of deeper issues: trauma, unmet emotional needs, academic stress, or lack of support. Instead of punishment, we should ask, what's really going on? Are they struggling with mental health, lacking a safe adult to talk to, or trying to cope with grief or anxiety? When we understand substance use in context, we're better equipped to intervene in meaningful, compassionate ways. When we treat substance use as the effect of deeper issues, we can redirect our efforts to address the root causes. Supportive environments are key. That can include prevention programs and peer mentorship, access to mental health services, academic support and after-school activities, safe and consistent adult guidance. Youth need a combination of resources, not just to avoid harmful behaviors, but to thrive. When we invest in their full well-being, we reduce the likelihood they'll turn to substances as a coping tool.
Need for additional support. Recognizing warning signs can make a real difference in getting youth the help they need. Here are some to watch for. Loss of interest in school or activities, dropping grades, changes in sleep, weight, or appearance, withdrawing from friends and family, new friend groups or secrecy, mood swings, irritability, or signs of depression. It is important to remember these signs might point to substance use, but they can also be related to mental health or other stressors. Either way, they signal a need for connection and professional support. I guess we'll skip over the rest because it's on you.
All right, so a little bit about us. So Memphis Area Prevention Coalition offers a range of programs to support youth and reduce substance use in our community. We use environmental prevention strategies, working to shift the conditions that allow substance use to thrive. This means changing policies, limiting access, and educating our community. Programs like Tennessee's Save a Life and Lifeline Peer Project connect people to resources, while Safe Point focuses on harm reduction. We'll quickly walk through some of these in detail. I'll skip this one since we've already gone over MAPC. All right, so real quick, the Lifeline Peer Project focuses on reducing stigma around addiction and increases access to recovery services. When somebody is ready to seek help, it's essential that resources are available and that they feel supported, not judged. If you or someone you know is seeking detox, treatment, or recovery in Shelby County, Lincoln Kaufman, I think he is over there, is the one to talk to.
SafePoint is a harm reduction program that offers syringe exchange and free testing services for HIV and Hep C. This program is open every Wednesday evening at the address shown. We also have a Fraser location by Van Cut Barbershop from 1 to 2 on Wednesdays, and in Midtown behind First Horizon from 6:30 to 8. Harm reduction doesn't enable drug use. It meets people where they are and helps prevent deadly consequences. Rapid testing, clean supplies, and referrals to treatment are all part of a larger recovery strategy. For more information on testing opportunities, you can reach out to Pat Kieran, over there somewhere, or me.
Yay.
Prescription take-back boxes. One of the most effective strategies in youth prevention is reducing access. That's where prescription drug take-back boxes come in. Many teens misuse prescription drugs they find in the home, often not even prescribed to them. But by properly disposing of unused medications, we eliminate that risk. Take-back days happen in April and October, and like Jack mentioned before, April 26th at the Kroger on Truce Parkway from 10 to 2, you can come dispose of your unwanted medication. Suicide and crisis line, mental health and substance use are deeply connected. That's why knowing about the 988 crisis line is so important. Anyone experiencing emotional distress, thoughts of suicide, or a mental health or substance use crisis can call or text 988 at any time. This service connects callers to trained counselors 24/7, regardless of where they are in the country. Share this number, it can save lives.
FindHelpNowTennessee.org is a real-time resource directory. It helps people locate nearby treatment centers based on the type of care they need, insurance coverage, and other personal factors. It's anonymous, easy to use, and mobile friendly, making it an incredible resource for those ready to take that next step towards recovery. And finally, our regional overdose prevention specialists, who I believe are they over there? They're floating around, they're here. But David Fuller and Tony Hampton. Our regional overdose prevention specialists offer free training and distribute life-saving tools like naloxone, a medication that reverses opioid overdoses, fentanyl test strips, which can reduce accidental overdoses, and training on how to recognize and respond to an overdose. They also connect people to treatment and recovery services. Keep their contact info handy. They are a valuable resource in our region.
And that's our presentation.
Thank you, everybody.